Oral questions by members.
Members, during the question period, no electronic devices to be used. Member for Penticton Summerland.
Thank you, Mr. Speaker. On January 28th, Chantel Williams was released from hospital late at night while in the care of the Ministry of Children and Family Development. She was found unresponsive blocks from her group home and was later pronounced dead. She was found by a passerby at 5 a.m. Chantel's death is not an isolated incident. Last year, 103 children died while receiving services from MCFD. But in spite of this death toll, the government has only implemented 9 of the 72 recommendations from the Representative for Children and Youth. Chantel's family is here in the gallery. They have been trying for months to get communication and answers from this government about Chantel's death. It has been 64 days since Chantel's death. My question is, how many more children have to die before this government implements the remaining 63 recommendations?
Minister of Children and Family Development.
Thank you, Honourable Speaker. I first and foremost want to give my condolences to the family that is here today. Your loss is devastating. I am sorry. Your family member mattered. She was important, and what has happened is unfair. I have cleared my schedule this afternoon. I would like to meet with the family if they would like to meet with me. I have provided information to the members opposite about our Child, Family and Community Services Act. I, under that act, as the Minister of Children and Family Development, am not able to publicly share information that I obtain under that act. I understand that this is frustrating. When I was in opposition, it was frustrating for me, Honourable Speaker. What I can say is that in general, in my ministry, anytime a child dies, we review the circumstances around that death. We do a comprehensive review. We work with third parties from this legislature, like the Representative of Children and Youth, like the Coroner Service, like the police. We work with those independent bodies to provide the information necessary. And wherever we can, we work with families. I understand that it is a very difficult process. And throughout that process, my expectation is that we provide families with support, that we pay for funerals, that we provide food support and counseling support. This is an unimaginable circumstance for any family, Honourable Speaker, and my heart goes out to the family today.
Thank you. Member supplemental.
The report, Don't Look Away, outlined the horrific death of a child in foster care and was released 258 days ago. Following that report, this government admitted that the system is broken and pledged to implement all 9 of the recommendations in that report. This government stood in this House and made that commitment. And here we are following the death of yet another child. My question is, why has this government not implemented these recommendations, and when can the public and families expect action?
Minister.
Thank you, Honourable Speaker. We absolutely are implementing recommendations of the Representative of Children and Youth. I meet the Representative of Children and Youth regularly to talk about the progress that our ministry is making on those recommendations. I also have provided comprehensive information to the member opposite on her questions, and will do so with any member in this House. I hate talking about numbers, Honourable Speaker. Every single child is a child that mattered. Their life was worth something, and it was important. I do have to correct the member because she continually talks about 103 children. I've provided her with the breakdown of that information. I have provided her with the information available. Of those children, 89 of those children were receiving services. What that means is that a child who is with their parent who might be receiving something like speech and language services or counseling services is counted in how we report child deaths in this province. Of the number that the member mentioned, 14 children who were in government care passed away. In each one of those situations, we do a review. We ensure that recommendations are followed up on. We take these deaths very seriously, Honourable Speaker. I'm committed to working every single day. The member opposite also sits on our Select Standing Committee for Children and Youth with the representative of children and youth and talks to that committee on the progress that we are making on those recommendations. We are making significant progress, Honourable Speaker. We have struck a Deputy Minister's Project Board. We are working across government on a comprehensive child and youth well-being plan and outcomes framework. I am committed to that work, and I'm committed to doing better for children and youth in this province.
Member for Columbia River Revelstoke.
Thank you, Mr. Speaker. According to the last report from the representative for children and youth, approximately 500 children go missing every year while in government care. No one was even looking for Chantal Williams the night she died alone. When will this government get serious about the safety of kids in its care and implement the 72 recommendations from the representative?
Minister.
Thank you, Honourable Speaker. I can assure the members in this House that there is nothing more important to me than the safety and well-being of every single child in this province. I am a mom of a 19-year-old and a 15-year-old. Every day that I wake up in this role, I think about the safety and well-being of children. Honourable Speaker, we are implementing the recommendations that the representative of children and youth has made. We also invested $321 million into the ministry budget this year because we understand that these services are vital to ensuring that children and youth are safe. We have increased our direct workforce working alongside families by 20%, Honourable Speaker. We have invested in services for young people who have aged out of care, Honourable Speaker. There is more work to be done. I am committed to doing that work. This government is committed to ensuring that vulnerable people in this province are kept safe. That is my commitment. I am willing to work with any member in this House on this issue. This is a nonpartisan issue. The well-being of children and youth is my top priority.
Member supplemental.
Well, that sounds good, Mr. Speaker, but the minister stands here and talks about money, action plans, and working on it. But meanwhile, children are still vanishing from care. Chantal Williams was missing. Was anybody even looking for her? How many more children will BC lose before this government treats them like they actually matter?
Minister.
Thank you, Honourable Speaker. Every child in this province matters. Every single day that I wake up in this role, every single day that I go to bed, I think about the children in this province. I think about the reports. I work diligently with the representative of children and youth. I meet with families, with community members. I have worked in community. I have worked alongside families. I understand the frustration. I understand that there is always more work to be done, Honourable Speaker. I will wake up every day and put every effort and every molecule in my body that I have to ensure that we are doing better, that we are responding to recommendations that are made, that we are working in community, that we are ensuring that we have strong oversight, that we are continually doing better. I will never, ever give up on doing the right thing for children and youth in this province. There is always better to be done, and my commitment to the children, youth, and families in this province, the service providers that provide crucial support, and to the members opposite and every member in this House, that I will never stop that work.
Leader of the third party.
Honourable Speaker, education is the foundation of a healthy society and a functional democracy, but it has been deprioritized by consecutive governments in British Columbia. BC ranks 9th of the 10 provinces in per pupil funding. Chronic underinvestment has left teachers unable to do their work effectively, undermining the opportunity for young students to get the education they deserve. When schools are inadequately funded and students spend their education years in portables, a clear message is sent to our youth. We are not sufficiently investing in you during the formative years of your life. Despite persistent inequities, no BC government has adequately addressed these issues in over 2 decades. Through you, Honourable Speaker, the Minister of Education, when will this government modernize operational funding for public kindergarten to grade 12 schools?
Minister of Education.
Thank you very much, Speaker, and I want to thank the member for the question. We have a shared passion for public education. I don't know if the member knows, but I actually was a school board trustee, and that's actually what brought me to my role here as an MLA, because I was passionate about improving the public education system. I remember a little guy, Lucas, who came to present to us at the school board. 10 years old, his glasses, came and sat in front of a table of a dozen adults to tell us what our budget, what it meant for him at the time. This was in 2016, honorable member. And Lucas told me about how he suffers from anxiety and other mental health issues, and how he desperately needs a counselor some days in school. And one day he went to his teacher and said, you know, I'm not having a good day. I need to see my counselor. And the teacher looked at him and said, I'm sorry, Lucas, it's Tuesday. We don't have your counselor till Thursday. Can you just hold it in? That's the day I decided to run for MLA. So I will work every day to ensure that we are improving our public education system for kids like Lucas. We have increased our funding year after year after year since we've formed government, and we will continue to do so. We will continue to make commitments around education because we know how important this is for kids.
Member supplemental.
Thank you. The BC Federation of Students points out that this chronic investment is felt not only in K-12 education, but also across post-secondary institutions. Our priorities should clearly be with the students of today and the workforce of tomorrow. If we want to improve healthcare, build more housing, grow our economy, and create strong communities, we have to start with world-class, affordable post-secondary education and skills training. Public post-secondary institutions are in peril. Programs are being cut, faculty and staff laid off. The government started a funding review in 2022 that would have brought problems with the funding model to light and proposed solutions. Through you, Honourable Speaker, to the Minister of Post-Secondary Education, when will you release the results of consultation and complete the post-secondary funding review?
Minister of Post-Secondary Education.
Thank you, Honourable Speaker, and thank you so much to the member across for this question. Post-secondary institutions are an economic driver in this very challenging time that we have here. I'm very proud of the 25 public post-secondary institutions we have in British Columbia, and we continue to support them in the best way that we can. Honourable Speaker, the unilateral decisions that the federal government has made in our international students has really crippled the way that we are funding our post-secondary institutions. I have been meeting with presidents, faculty, staff, and students about the challenges that they are facing right now, and we are there for them. We are working with them hand in hand and making sure that any financial challenges are not crippling the programming that we are providing for them. We will continue to support them, and we will continue to make sure that we have high-quality education here for our post-secondary institutions.
Member for Surrey Cloverdale.
Thank you, Mr. Speaker. Last month, a young nurse took her own life after being attacked twice on the job, one incident happening while she was alone. The health minister responded to questions from media by placing blame, saying her expectation is that the health authorities follow the rules for safety. Mr. Speaker, frontline workers tell me that it's chronic NDP staffing shortages that are placing nurses and other healthcare workers in danger on a regular basis. If the minister is looking for someone to blame, Mr. Speaker, she need only look in the mirror. When will the Premier and the Health Minister truly take the safety of frontline healthcare workers seriously?
Minister of Health.
Thank you so much, Honourable Speaker. We all know that hospitals and healthcare facilities are places where people go to seek help and support to feel better, and that our nurses, who are truly healthcare heroes, are doing their very utmost and deserve a safe workplace to be. Mr. Speaker, just this morning, I had the opportunity to meet with frontline nurses and hear firsthand about experiences that they have had. With respect to this nurse that the member opposite refers to, it is simply a devastating situation, and I think every single person in this place, their hearts go out to her friends and her family. We have heard and seen that she was an important part of her community, giving so much, and this has got to have huge ripples across her workplace and across her community as well. Mr. Speaker, violence has absolutely no place in the workplace, and that's why we've taken steps together with the BC Nurses Union and health authorities to add security resources into hospitals and establishing the Relational Security Initiative program. We've made the commitment and have hired 320 of these relational security officers. Mr. Speaker, we have over 750 of them placed in facilities across British Columbia. We're going to do more. We need to do more. More in terms of violence prevention and the curriculum and the training that people have access to make sure that patients, nurses, and all healthcare workers are safe. Thank you.
Member supplemental.
Mr. Speaker, the first time 33-year-old nurse Roseanne Wallace was attacked in the psychiatric unit where she worked, her shoulder injury required surgery. The response to that attack was to install a panic button. Mr. Speaker, I'm going to ask every member on that side of the chamber to imagine being a nurse. Imagine being choked, punched, kicked, attacked by a violent patient. Now imagine having to push a panic button because there aren't enough staff to restrain that patient, and there aren't any security officers posted to that unit. My question, Mr. Speaker, is how many minutes do you think it's acceptable to have to wait for help to arrive?
Minister of Health.
Thank you, Honourable Speaker. The member is correct in that we need more nurses on the floors here in British Columbia. And that's why we're taking the actions that we are to build the nursing workforce across British Columbia. Mr. Speaker, we've had the fastest growing workforce across Canada here in BC. Since 2017, we're only behind PEI. Mr. Speaker, we've added 1,500 more nurses in the last year alone. We've made commitments around a minimum nurse-to-patient ratio that we know is making a big difference in places like Smithers, where nurses told me about this morning. They're beginning to meet those nurse-patient ratios. That's making a real difference on the floor for nurses there. And we've got to keep doing that work. That's why we're going to continue working in partnership with the Nurses Union. We're going to continue to create better working conditions for nurses across British Columbia. And they are big challenges, Mr. Speaker, but it takes all of us in partnership, working together. We're going to get this work done because we know that nurses deserve better. We know that British Columbians deserve the health care when they need it and where they need it. And part of that, so much of that, is delivered by our nurses. Thank you.
Member for Chilliwack North.
Thank you, Mr. Speaker. More than 6,000 children have died or suffered critical injuries this past year on this government's watch. We know that a disproportionate number of those incidences involved Indigenous children, which is tragically a repeating pattern. How many more children will be put in harm's way or die before this government implements all 72 recommendations?
Minister of Children and Family Development.
Thank you, Honourable Speaker. We are absolutely committed to implementing the recommendations of the Representative of Children and Youth. I meet regularly with the Representative of Children and Youth to discuss where we are at with those recommendations. Some of those recommendations have been implemented. They are immediate recommendations, recommendations like timelines that social workers visit youth who are in care. Those have been completed. The Representative of Children and Youth also has made recommendations that are systemic and take longer to complete, Honourable Speaker. Those recommendations are recommendations like a comprehensive child and youth well-being plan and outcomes framework, a whole of government approach to how we support families. When families interact with my ministry, they are at some of the most difficult times of their journey. There are multiple things that we need to do to address those challenges. It's very important work, Honorable Speaker. It is work that I take incredibly seriously, and it is work that we are committed to. We are transforming our child welfare system, Honorable Speaker, in working with Indigenous communities, Indigenous governing bodies on the resumption of jurisdiction of their children and families. This is very important work, and it's work that we're committed to.
Thank you. Member for Surrey White Rock.
Thank you, Mr. Speaker. After being released from the hospital to her group home, Chantel Williams should have had support. She should have had supervision. She clearly did not have either of those things. Instead, she's able to leave undetected and then found unresponsive hours later and passed away. Now, this government stood in this House almost a year ago and committed to implement these critical, important recommendations. Today, 9 out of 72. That's not good enough. That is not good enough for the children of this province, and it wasn't good enough for Chantel. The family can't even get basic answers of what happened when she left the hospital. My question to this minister, my question to the Premier is a very simple one. What are they waiting for to get these recommendations done, completed, to protect our children today?
Minister.
Thank you, Honorable Speaker. Again, the safety and well-being of children is my #1 priority. I am committed to working with the representative of children and youth. We meet bi-weekly. I work with her closely on her recommendations. I want to correct the member opposite. Of the 72 recommendations cited, 44 of them are directed at the Ministry of Children and Family Development, and 29 of those are complete or already in progress. This is very important work. I'm happy to work with any of the member opposite on what we're doing and providing more information to the members opposite on how we're doing that work. Again, committed to working with the representative of children and youth and her independent office from our government, and thank the member for the question.
Member for Abbotsford South.
Thank you very much, Mr. Speaker. 13-year-old Brianna McDonald died of an overdose in a homeless encampment in Abbotsford. She was just 13, a life ahead of her. Brianna struggled with mental illness and addiction, and after being bounced between the Children's Hospital, Surrey Hospital, doctors, counselors, and therapists, Brianna wound up homeless in an encampment in Abbotsford. Her parents begged, pleaded for help, but the system, this NDP government system, ignored them. Will the Premier stand in this House today, especially considering there is a family present who lost a loved one, and admit that under his government, under his leadership, that the BC NDP are failing the very children they swore to protect? Or will he yet once again shamelessly leave it to one of his ministers to apologize and answer on his behalf?
Minister of Housing.
Thank you, Honourable Speaker, and my heart goes out to the family as well. When we hear of anyone being in an encampment in any community in the province, we know how difficult of a situation that is. We know how it's unsafe for the people that are living there, and it's not really safe for the community at large. I've been working closely with communities like Abbotsford to try to scale up supportive housing. I really hope we get to a place where we all in this House can stand up and speak about how important supportive housing is for our communities. because that's the opportunity where you can get people indoors, you can get them the supports that they need. Having people sleeping in encampments and in parks and in tents, you can't get them the supports that they need there. You need to give them shelter. You need to be able to provide the wraparound supports. That's why we've been scaling up supportive housing in communities at record pace, because it's not acceptable to have somebody living in an encampment. It's not acceptable to have someone living in a tent, Honourable Speaker. So again, my heart goes out to the family. We're going to continue the work to scale up supportive housing opportunities so that young people, seniors, anyone that needs a home can go there and get a place and get all the supports that they need.
Member for Abbotsford Mission.
Mr. Speaker, children deserve to grow up in safe homes and safe communities. But under this NDP government, they aren't. In my own riding, a 5-year-old girl, yes, I said 5, had to be rushed to the hospital after overdosing on fentanyl. What should have been a normal evening, routine turned dire when she reportedly handled a jar of fentanyl. What kind of province have we become when children aren't safe in their own homes? Mr. Speaker, how can the Premier claim to be protecting our children when they're being rushed to the hospital for fentanyl overdoses?
Minister of Children and Family Development.
What the member describes is horrific and awful, Honourable Speaker, and should never occur. As a mom, I am devastated by that story, and I think we are all devastated by that in this legislature. We have a Child, Family and Community Services Act in this province that governs making sure that children are safe and protected. The member is right. Every child deserves to live in a safe home, in a loving home, and in a healthy home. And my expectation is that my ministry does everything possible to ensure that that occurs. When there is a safety concern for a child, we are required by law, whether that be in a hospital, in a community, in a school, to provide that information. Any circumstance where a child is at risk, a social worker has the ability to investigate that situation, and then there's a process that occurs out of that, Honourable Speaker. What the member describes is horrific, and I am appalled to hear of it.
Member for Chilliwack, Coults Lake.
What we've heard today in the House is a terrible string of events that's happening to our most precious asset that we have in this province. That's our children. Over and over and over again, this government has failed children in their care. It's heartbreaking and it's infuriating that this government cannot do the job it's committed to, and that is to keep children in care safe. There's a family that made the long trip today from their community to come here. They're sitting in the gallery and they're mourning the loss of their family member. This is fresh for them. Her brother's here. They were in the care system together. They were separated. And I know he carries a heavy weight on his shoulders because of that separation. But they came here today so that they could be heard. And they'll never see their family member again. I'm asking the Premier today to stand up and speak, not to me, not to the opposition, but to the family of Chantel Williams. And please tell them why their family member died in the cold alone when she should have been safe and warm in the care of this government.
Mr. Premier.
Thank you, Honourable Chair. I thank the Opposition House Leader for the question, and I thank the Opposition for providing the family the opportunity to be heard here today. The Minister has outlined the frustrating legal constraints on us, preventing us from talking about any particular case. It doesn't constrain me from saying to this family that this was a precious child. She shouldn't have died. Any time that a child dies in care, it is a failure, and we need to learn all we can to prevent the deaths of any other children in care. I can assure you, and I assure all British Columbians, that this death will be investigated independently, that you will get the answers that you need. There are not one, but two independent offices set up, independent of us, independent of the Minister, to get you the answers that you need and that you deserve. And I just want to underline that the Minister has, in fact, cleared her schedule to meet with you, to talk with you one-on-one. I hope you take her up on that offer. But regardless, thank you for making the trek here. Thank you for having the courage to share this story. It's important for all British Columbians to hear. And you have my assurance that we will get you the answers that you deserve.
The bell ends the question period.